short introduction about the speaker, Dr. Arushi Chawla. Dr. Arushi is an assistant professor at the Department of Forensic Odontology, Parul Institute of Applied Sciences, Gujarat, India. She completed a Bachelor of Dental Surgery, after which she gained a deep interest and passion in forensic odontology. She went on to pursue her MSc in the said field. She is a medical and a scientific writer and is currently pursuing a PhD in forensic limnology. She has been a very enthusiastic academician and is known for a sheer dedication in teaching. Without wasting much further time, ladies and gentlemen, presenting to you Dr. Arushi Chawla live on the topic Introduction to Forensic Odontology. Over to you, Dr. Arushi.
Thank you so much. Good evening to all of you here. And it gives me immense pleasure to be on this platform and be able to talk to you today. And first of all, thank you so much for being here. And I wish this festival of life, since we are stuck in this situation together, we'll hopefully come out of it. And yes, everything has a pros and a cons. So I think let's consider this to be an advantage. And maybe that's how we can communicate around the world. So I'll be just sharing my screen and I'll be quick. Okay. As I am a forensic odontologist, it gives me a lot of, I'm glad that I can introduce you to this field because of Dentist Channel. And thank you so much for giving me this opportunity. And today I'll be taking you to a journey which is more of, I can say, unexplored, but explored by people who have been, who worked for this really hard. And there have been deeds which are done and which are not known to many of us. So as dentists, as in whenever we talk about forensic odontology, to be more specific, I think there is, as dentistry tells us, what is dentistry to us? It was like an art and science. So what do we know about these fields? When we talk about, we know oral pathology, we know medicine, we know periodontics, oral surgery, prosto, conservative, periodontitis, PhD. We all know about these subjects, but there is one more subject which is just a part of oral medicine as well as oral pathology. I think many of us might have come across the word forensic odontology in the third year when we were studying about oral pathology, to be more specific. Forensic odontology is something like whenever we come across the word forensic, these are the certain pictures which come to our mind that, this is how forensic is supposed to be. It's about Sherlock Holmes, it's about forensic files, it's about maybe Hannibal, CID for people in India, Asur. There have been excellent series which have, done some commendable job. But when you talk about the word odontology, it is broad. It is just not about bite marks and age estimation. We do help people for identification as well. We have different fields. We have rugoscopy, we have keloscopy, we have non-metric dental traits, data for which, of course, we've been working for a very long time, but we need a lot of people who can cooperate with us. And, around the world, we could, just like fingerprints, generate a data which is more specific to teeth. This is how we together can take dental research forward. So when you talk about forensic odontology, to be more specific, and I don't think I can define it, even after being a forensic odontologist, and the first time I heard about the word forensic odontology, and that definition was actually very complex for me to understand, because it said that it's the art and science of dentistry, which in the interest of justice deals with dental evidences. It's true. We do handle dental evidences, and nobody else can handle teeth better than a dentist. So if I can be more specific, we are the people who can deal with the live as well as the dead, right? So teeth, they always say the truth because they have a tail which follows them. What not can be said, done by the teeth prints, to be more specific. So when I talk about the definition, of course, it's highly complex. And unfortunately or fortunately, maybe this opens new doors to us, but this particular field is unexplored. Uh, Back in the time of, as in, I don't know, maybe hundreds or 200 years ago, this was being used, but nobody mentioned it as forensic odontology. Nobody gave that importance to us. So I think this field, of course, being more and more, unexplored, can be advantageous to people who want to pursue forensic odontology forward. Defining forensic odontology, I think, is unfair because there are no sentences which can define this. To be more specific, forensic odontology is basically a branch which can help you to establish the identity of any individual just by the dental evidences. How do we do that? I mean, it's shocking to know, how do we exactly go forward with this? I don't know how many of us know about it, since most of people here would be dentists. I don't know if you've heard about it or not. Something known as non-metric dental traits. Now, when you talk about non-metric dental traits, the cusp of cerebelli is the biggest example of it. Then there are others which follow. There is Talon's cusp, and there is shoveling, there is winging of incisors. These are specific characteristics. Let me be more precise. These are specific characteristics which help you to identify individuals. Like if I have to be identified, I have one lateral incisor which is slightly lingually pushed, right? It's lingually placed. So maybe that becomes my identity. Now, what you see on the screen is the first thing which you see here is the cusp of cerebelli. Now, cusp of cerebelli is more common with Europeans, and that's more common in the European race, but we do find it. Hopefully, we are coming up with a study very soon where, region specific, we are coming up with some dental traits. That will be very soon, but of course, I need more hands. This, what you see here, is a Talon's cusp. Approximately, this is found 1 in 6,000 individuals. So I don't have to say, this can be used for identification. Then these are others which follow. This is the winging, and then there is 7 cusp molars. There is 3 root premolars. Then there are others which follow, and yes, they are specific. They can be used to establish identity. But the question comes here. I mean, why do you have to use teeth? Why not the others? I mean, we already have a database for the fingerprints. Why do you have to go for the teeth? They are durable. Maybe, yes, I can prove that it's durable. They can survive under extreme environmental conditions. Even after years of, the archaeology department have many times come across skulls which are 600, 700 years old, but still have, proved to have been done. We have done the dating of the events which could have led the death of an individual. So it's like trailing the entire events together and finding out what exactly happened which caused the death of one or the other individual. So this is like this specific thing, and it was found approximately 600 years ago, and it's only the teeth which remains, it remains there. Nothing happens to them because it's made out of enamel, and all of us know that enamel is one of the hardest material present in the body. It can survive extreme weather conditions. It can survive in water. Trust me, no changes took place. Even after 30 days, there was no change. So in cases of drowning also, we can use teeth, and they do give a lot of information. Under heat, now there is one more study which says that, this is teeth which has survived approximately until around 600 to 700 degrees centigrade of temperature. And this study has been done by NFSU, and I think these things can help you estimate if at all you come across such a case, maybe you can know what was the fault in the plane which led to the plane crash. What was the temperature? If you come to know about the temperature, I don't think for technicians it will be very difficult to determine what was the fault which exactly happened, during the crash. So I think teeth can take you back and help you to trace the entire series of events. That's why they are considered to be very important, and that's why we stress on forensic odontology so much. Apart from this, I think teeth can give a lot of information about the systemic diseases which can be diagnosed. Of course, there are tests which can diagnose, but then there are certain signs and symptoms which you can see in the oral cavity as well, which can tell you a lot about the underlying disease. The first image which you see, it's a case of iron deficiency anemia. There is scurvy, the vitamin C deficiency, lead poisoning. This is how lead poisoning appears. I mean, later on, of course, this can serve as early diagnosis. We can use the signs and symptoms which can be seen in the oral cavity. And sometimes now, of course, we've already learned about all this. But then what happens is, this is something which can, help you to narrow down the population in case of a mass disaster. Like if at all some bodies have, after a mass disaster, there were certain bodies which came up, and after the antemortem data, you came to know that the other person was suffering from a severe iron deficiency anemia. And if in one or two cases you see that, these are the structures which you see, maybe that's when you can know that maybe the family and this person is related. So we can narrow down the population like that. Now, this is one interesting calculation which was done by Fellingham and his co-workers. They found out, they actually tried to, make possible combinations of 32 teeth. You have 32 teeth. So what they did was, they said, let's make combinations of intact teeth, decayed teeth, missing teeth, restored teeth. And they found out that there are more than 1.8 into 10 raised to power 19 combinations which are possible, which itself proves that yes, there is uniqueness inside a dentition. If I have certain characteristics, it's not necessary that you do have the same. It's not possible. Even if somebody has a lingually placed central incisor, then my degree of that placement of lingual rotation would be different from the other person. So yes, dentition is unique and requires people who can, make it more admissible in the court of law. What can forensic odontologists do? We can establish identity. We are useful in civil cases. We are useful in criminal cases. And when there are plane crashes, when there is a mass disaster, there are earthquakes, when it comes to, the natural disasters or maybe a bomb blast, forensic odontologists have played a very important role, a key role, along with forensic anthropologists, to establish identity and move forward with the analysis. We can actually, with other bones, of course, can work with anthropologists, osteologists together and establish identity. Then in the civil cases, we can help to estimate the age in case there is a dispute regarding the same. Bite mark cases, the criminal cases. So these are the different areas we can definitely work upon. We can say, we can determine racial differences as to, if I have to, I have to differentiate in case of a earthquake or maybe a plane crash, where I would have found people with different nationalities. I can estimate that, if a shovel-shaped incisor is present, then it is more common with the American and the Indian population as compared to the Negroids and Caucasoids. If I find that there is a diastema which is present between the two central incisors, that's more common in the Negroid population. So All these things can at least help you narrow down one. And second, it will take you more close to identifying an individual. Sexual differences, yes, sexual dimorphism is possible through teeth as well. When you talk about the curve of the teeth, that's more soft and smooth in cases of female as compared to the males. And the labial surface, which I hope many of us know, the facial surface is more curved in cases of female and it's flat in cases of male. These are just a few examples because, of course, I don't want to take a lot of time. These are one or two examples. I can tell approximately 20 differences which are present between a male and a female population. So, yes, there are many differences. Age estimation. So that's what we can do. We can determine the race, we can estimate the age. There are not less than 25 methods which can be used for estimating the age. And what you see on your screen is just a few. It's a less number actually. We have divided age estimation into fetal age estimation, adolescent age estimation, adult age estimation, and we have many methods and formulas which are more specific to one kind of population. Maybe the same method was being used for the Italian population, for the French population, and we in India have come up, the forensic odontologists, the renowned forensic odontologists have come across and made formulas. They have derived formulas which are more specific to the Indian population, so as to help or assist forensic scientists in order to convict people in criminal cases. And that one example of it was the Nirbhaya case, of course, which I'll be discussing about in detail. So forensic odontologist in a broader aspect can be divided into human identification, and then there is bite marks. In the human identification, we do the racial differences, the age estimation, and there are many things which follow. There is comparative identification and postmortem dental profiling. And then there is bite mark analysis, of course. What do we do exactly when it comes to postmortem dental profiling? Comparative it's a broader term. When you talk about postmortem dental profiling, is then you come across an unidentified body, maybe or may not in a mass disaster. It's not always very easy that you'll be able to look at the person and just say that this is that particular individual. Sometimes the shape of the body is not capable enough that they could or be able to determine the identity. So that's how you try to note down certain specific characters in the dentition and then try to establish identity and compare it with the antemortem data. History, I'll be quick. The first case was back of the Lolia Paulina case, which happened in the 49 AD, where individual characteristics did play a very important role. Where because Lolia Paulina had that extra, there was a supernumerary canine which was present, and she was killed. And later on, she was identified that this is the body. Ultimately, when they came across the body of Lolia Paulina, it was completely decomposed, so they could not identify her. But then she had a supernumerary canine, right side canine. So that was that one tooth which was used for the identification, and yes, the process of identification was taken. This case was the first case. The Raja Jai Singh case was the first which took place in India. It was back in the year 1999, 1199 to be more specific. And he was identified because he had a black tooth present, a front tooth which was discolored. And he was identified, he was killed in the war, and later on was identified because of this. The father of forensic odontology is Dr. Oscar Amido. He has, of course, various things and various publications, and he had written a book which could tell about the role of forensic dentists, to be more specific. So what he did was he established the role of a dentist in forensic science, and he identified them that, even dentists can give a lot of information. Some of the famous cases which played a very crucial role for forensic odontology. This, whom you see in the slide, the picture which you see is Adolf Hitler. He was identified. He was, of course, killed, and there were many theories which came up that, he's not killed, he's still alive, and because of the entire conflict which happened in Germany. He was basically identified because he had a false bridge, an entire bridge which was present for the anterior teeth. So there was one person who identified and said, and then from his pictures where he was smiling, the smiling pictures are a very important evidence for all of us. Of course, if there are people, yes, forensic odontologists do require a smiling picture. So in that one smiling picture, they could, say that, yes, this is Adolf Hitler, and, he had a false bridge which was present, and yes, this is how he was identified. Uh, Rajiv Gandhi, he died in a plane, in a bomb blast, and he was identified because of a displaced tooth which he had, and there was a diastema. If you can see it in the picture itself, since he's smiling, there was a diastema which was present. The entire body was burnt, but the tooth was the one which remained intact. So this diastema played a very important role in his identification. The president of Pakistan, Ziaul Haq, many theories came in at that time also that, he's not dead, he's just hiding, and there was some terrorist relation which was, declared at that time as well. But he was also identified because of the peculiarities which he had in his dentition. Bite marks, this was about the postmortem dental profiling and the comparative dental identification. When we talk about bite marks have also played a very important role in, in convicting of various suspects in criminal, as well as, to be more specific, in sexual assault and rape cases. Bite mark, for your information, we have around 10 different types of bite marks, and there are different techniques which are used for identification through these bite marks. There is a superimposition technique, trans-elimination technique, which are being used, and the criminals are being convicted. This is a very famous case. I think that this happened in Canada. He was known to be, his name was, to be more specific, his name was the vampire rapist. He was a serial killer, and his modus operandi, as in, there was one pattern which he followed, and he was to leave bite marks. So there were approximately 4 victims, and he was convicted because he was identified using a bite mark which he left on one of his victims. It was very, very brutal, as well as it was deep. So yes, they used superimposition techniques, and then they took his dentition, and he was convicted accordingly. One of the few cases which people do not know about is the World Trade Center, the 9/11 attacks which took place on the WTC, the World Trade Center. Approximately 50%, because it was so bad, the condition of the bodies could not be identified, and no near and dear ones could even see the body once. Almost 50% of the victims in the World Trade Center were identified because of the peculiarities which they had in their dentition. So imagine if that time there was more awareness here in India as well. I think forensic odontology would have been a department in many of our colleges. This is one case which has been solved in India. This is the Anigeri case back in Dharwad. This is just a short story. I'll be quick. In this case, what happened was that it was raining, and because there were floods in that particular area. They tried to, there was harvesting which was going on, and they tried to build that entire lane for the water to pass. As soon as they dug out the last part, they found one skull. When they tried to take that skull out, they found 600 more skulls. 600 means these were 600 skulls, approximately, to be more specific, 610 skulls, which was done by Dr. Asht sir. And he identified these skulls. What happened with them was, because this was 600 skulls, was not very easy to identify. I mean, 600 skulls, no trails, no but there, yes, of course, there were theories at that time. There were five theories that there must have been a war at this area, because this specific area used to be the center between it was Dharwad, so it is close to the southern kingdom, it's close to Hampi. So they felt that there must be a war, but there was no paperwork, because this was back in that time where the British rule was more was there. So they said British rule. There was one thing more specific, is that there was a lot of paperwork which happened at that time. So there was no war. So that theory was ruled out. Then the other theory which said was, okay, then there must be human sacrifice. So they said in British rule, you cannot do human sacrifice is just not possible. Dharwad was famous for that at that time. They said whenever there used to be any, natural calamity which occurred, there was human sacrifice. So they said back in the British times, human sacrifice is also not possible. Said, okay, let's then try the trailing technique. We'll try to trace them back. So they went on with the identification, and it was so difficult that even when they tried to pull out the skulls, it was not possible. So what they did was that, okay, they said we'll choose those who have their dentition intact. So from that, they came to know that there were populations of each age group. I mean, there were children, there were women, there were men, everyone. So that's not a war. The children are not usually, or the children are not a part of the war. So back when they tried to, know about the cause, they said it's a natural calamity because the entire village has been washed off. So in one of the gazette of Mumbai, they found out that there was a drought which happened at that time, a famine which took place and which washed off an entire village. So this case was solved because this major breakthrough happened to be done by Dr. Asht sir and his team. So this is how a breakthrough took place, that archaeological sites, importance, the sites of archaeological importance. This site was identified and traced back in time because of forensic odontology. So I welcome any questions if there are. This was about forensic odontology, and there are many unexplored aspects of it. There are databases which are being, we are trying to come up with databases. We're trying to come up with new researches. If you see here, I would like to introduce one of the techniques which was being done by me. The first or the second slide, where we saw about the different modes of identification. There was a research which took place, and this particular thing is not alginate. It's a gum. It's chewing gum, right? So there is a patent to that solution which was used, so that chewing gum could be brought to that consistency that a lot of people go away, because there is a protocol in forensic science that you cannot touch even the victim or the suspect without their consent. So if a victim, if the suspect says that I have gagging issues, I have dental anxiety, I cannot put this tray inside my mouth, he can, this evidence has no value in that case. This specific technique will stop all that. There is no person who is allergic to any of the substance which is being used. It's easy. It's not technique sensitive. The solution is cheap, readily available. So I think, and it has recorded the morphological details well, even better than the alginate, to be more specific, because in alginate to get the talon cusp is not easy, right? This was just one example. I could even record tongue prints out of this. So there are newer and newer researches which are being done, and which are being welcomed in forensic odontology, and hopefully will be many of us will be interested in taking this forward. And I'll be more than happy to answer any questions if there are.
Thank you so much, Dr. Arushi. I think it was a wonderful insight to what forensic odontology is. And friends, it's now time for us to have a quick question and answer session. Before that, quickly, we'd love to give you a gist on what we have planned for everyone who's interested in learning the science on forensic odontology. Yes, friends, Dr. Arushi is quickly giving you an insight. But friends, we do have a 10-day workshop on forensic odontology. This has been specially designed in association, the association between DentistChannel.Online and of course, the very passionate Dr. Arushi Chawla. It will be a 10-day workshop as it was mentioned earlier. So those are the 10 topics that you can see on your screen. We've kept it at a very minimum cost. Yes, I'm sure you all would be surprised with the cost, but yes, that's the cost we've kept only for the matter of fact being that we would want you to explore this wonderful field, this new field, because we know there are a lot of passionate dentists who wish to become aspiring researchers and other professionals in the fraternity. So if there is anybody who wishes to be a part of this workshop, which is going to take place from February 2021, it's a 10-day workshop. It will be an intensive workshop. Dr. Arushi Chawla would be the chief workshop mentor. We invite you, we invite the young and the experienced, we invite everybody who wishes to explore this wonderful hidden field in dentistry, and that is forensic odontology. So how can you get in touch with us? You can message us. We are available on WhatsApp. You can call us. That's the number which is there on your screen. If you have any queries with regards to the workshop, you can get in touch with us. We'd be more than happy to answer to your questions. And we would be more than happy to have you as participants for the workshop. As mentioned, it's a 10-day intensive program. The sole aim is to help you to explore this science. Before I forget, I'd also like to tell you that it's an internationally accredited online classroom learning program. By that, what I mean is post the completion of this workshop, you would be getting an internationally accredited certificate from the Federal Dental Association with international CPD points from Germany. So if you are interested, you get a certificate, you get guidance for the workshop, you get a lot of softwares which are used in the planning and understanding with regards to forensic odontology. So if you are interested, we would be happy to have you as our participants for the workshop, which is starting from February 2021. Do not forget the time, the dates, sorry, which is February 2021. We'll be announcing the actual dates soon. For that, you can stay in touch with us. The number which is there on the screen, you can message us. You can save this number and you can get in touch with us as well with regards to the workshop. If you wish to get international and national dental news updates on what's happening all across the world with regards to dentistry, you can save this number and you can message us your full name. It's the same number which was there in the previous slide as well. So this is our company number. You can get in touch with us. We are called as DentistChannel.Online. Please message us your full name after you save this number. Thank you so much. And it's now time for a quick question and answer session. We have the first question from Dr. Preetham. What is the role of Ruge? I think I have read somewhere that it acts like a fingerprint.
Yes, rugoscopy is very specific. I think we have covered this in our workshop as well. Ruge patterns, which are present on the anterior palatal portion, they have been very useful for identification because we do have classification based on their shape, their size, their position, unification. So of course, this is very specific, and yes, it is unique. But we do require people who do a lot of analysis, and like I said, because it's unexplored, and there is not a lot of people who have who've been known to this particular branch, and that's why we've kept rugoscopy in that particular workshop as well, where we'll be doing the analysis of the rugae patterns based on the different classification, and then prepare something known as the IRC, the integrated rugoscopy chart. I think this will be a little more technical, but yes, it can be used for identification, and there is a technique and charting which can be used for the same.
Thank you so much for answering to the question. Before we move with the further question and answer round, we'll be running a short poll, ladies and gentlemen. Please do answer to the poll. This will help us in identifying if how interested you are with regards to forensic odontology. So while you are answering to the questions in the poll, it's a short poll. Please do answer. We'd love to have you all answering to the poll. We move to the next question. Doctor, could you please quickly tell us the kind of work opportunities, the kind of opportunities in general one can have after being a part of the course or after understanding what the science of forensic odontology is in general?
See, when I talk about the scope, I think we do have scope everywhere. If been being a dentist, if you want to help people in the police and police people and the police and entire academy, once you pursue forensic odontology, you will be a part of forensic as well as dentistry. So I was a dentist when I started pursuing forensic odontology, and now I'm more integrated towards forensic. So the people who are interested more into research, if they wish to pursue things forward and move forward with the research instead of being just a clinician, I think this is one of the best fields one can explore, and it has been very useful by now. We have scope in the forensic department. In the FSL, people do require in CID. Yes, I have assisted people there. We've been trying to pitch it into cases, and our I think our opinions have mattered a lot. So don't think that odontology is a small field. It has the capability of being a huge department, because this is not one there's not just one thing which can be included. This is like a Pandora box. You open it and there is it's full of knowledge. You get to know about medicine. There is something known as forensic radiology, where you can explore violent crimes. I'll just give one example to those who are interested. I think when most of us were studying oral radiology, we came across a table. I still remember it was there in the Frenny, and where we could determine what was the the cause, or what was the systemic disease, or what was the carcinoma, the type of carcinoma, by the appearance which was there. The same thing can be applicable to violent crimes. The bullet shots, or the violent crimes which include the more of ballistics and armamentarium. There are different shapes which are being or different patterns, which to be more specific, which are being formed in the part which is being shot, which can be helpful to determine what kind of bullet was used, what was the direction, what was the distance. So all that can be known, and I think this is a huge field, acting like a sea of knowledge, because there is no stopping here. If you entered, you have entered every field.
Absolutely. I think there couldn't be any more better answer to it being the last sentence, which is if you've entered to this field, it's always a world of opportunities and to explore. Dr. Arushi, could you tell us a few options one can have after they have pursued this course, or let's say, for example, they've pursued this course in general in India? Are there any opportunities for somebody if he or she wishes to move abroad?
Yes, there are. I mean, in Canada specifically, we do have a lot of opportunities coming up in forensic institutes, where they require people in academics who can teach their the crime scene investigation team, the CSI. They are now requiring odontologists, as and when they are trying to know that these are certain fields, and dentition is something which will neither undergo putrefaction, no decomposition, put the teeth into the water, no change, right? So even in drowning cases, our opinion are being supported and taken. And bite mark cases, of course, we've excelled it. Nobody can, take you more close. Keloscopy, I mean, I don't know, I somehow I felt I was quick because I thought I should not take a lot of time. Keloscopy, there's a very interesting story behind it also. Keloscopy, you might be feeling, what is study of lip prints? I mean, why do somebody would like to study lip prints, and where would you find at a crime scene? The first case was actually solved in a way that the criminal entered. I mean, if the criminal enters with a thought that, you will get this amount of money in the house. He entered and he found gold at that time, and he was so happy when he left. He was very happy when he left the crime scene, and in his excitement he made a mistake. He went and kissed Mother Mary's picture, and on that picture the lip print was left behind. So these are certain things where people are not aware about. The criminals go, they drink, they eat, and the lip prints are unique in its own ways. I mean, there was one study, if you would like to go, there's a publication, biometrics in twins, monozygotic, dizygotic, everything is different. They are unique in its own ways. So I think even keloscopy, so even if it's this small a field, is highly appreciated. Then the entire field of odontology in for abroad as well is being asked for, and the crime scene management team is requiring our presence now.
Absolutely, yes. And I think, like we've already discussed, there is a huge horizon, there is a huge field to explore. And friends, if you are interested, we'd be happy to have you for the course that is going to take place in the month of February 2021. Yes, we've kept it at a very minimal cost so that we can help you to explore this field, this world, this science, and the art of forensic odontology. So if you are interested, you can always get in touch with us, DentistChannel.Online. Thank you so much. My name is Ruben. It was a pleasure hosting this evening. Once again, we wish you and your family a very happy festival of lights. Happy Diwali to you, your family. May the good Lord bless you and your family.